We're here with Dr. Enrique Gomez, who is a neonatologist and pediatrician, and he has special knowledge about feeding babies, especially newborns.
Currently, I'm the head of the pediatrics department at Seminars, and I'm a neonatologist, but I also do work as a pediatric hospitalist. So I work with babies doing perfectly fine, and also on the sick baby that is at the intensive care unit.
For the audience, how does infant feeding go wrong when a mom is trying to breastfeed?
But based on my observation, I would say that 60% of breastfeeding women will have some form of breastfeeding issue. First of all is excessive weight loss. The second issue is that the baby doesn't appear to be fed enough, like the baby is constantly crying. Another issue is, of course, jaundice, hyperbilirubinemia. We have a lot of babies who have elevated levels of hyperbilirubinemia. And obviously because we have a lot of maternal diabetes, so we have a lot of babies that are actually struggling or fighting with this. That's a big number.
But do you see those problems in healthy parents as well? Or is it just, okay, yeah. All right.
Yeah. Sometimes you have delayed lactogenesis. Sometimes you have to have a stat C-section. Sometimes you haven't slept in 3 days. It's funny that actually the most complicated cases that I had of those have been on healthcare workers.
You mean the parents are healthcare workers?
Yes, because we are like, okay, no, you're a healthcare worker, you know how to do that. You get readmitted because of jaundice or because of weight loss.
Can you tell the audience how jaundice is related to excessive weight loss and adequate feeding?
The liver in a newborn baby is still developing. The enzymes that take care of the bilirubin that causes jaundice are still developing. As each hour of the baby's life passes, that metabolism gets better. So for you to be able to get bilirubin out of the system, you have to eat. By eating, you're pushing that bilirubin out. So the first thing that we do when a baby gets admitted to the hospital because of jaundice is check how the feedings are. And if the baby is not eating well, and if the baby is in the intensive care unit, the first thing that we do is we drop a tube all the way to the stomach. We bypass the mouth, we bypass the latching, and we just give them food. That's the cornerstone of the treatment for hyperbilirubinemia. You don't
Is
treat
that for all babies? Do you have to drop a feeding tube?
If the baby is not eating well.
But if they can take things by mouth?
Then we set a minimum. Yeah, we set a minimum of how much we wanna give them. Now, on top of that, we give them hydration, we give them phototherapy. But if you don't feed the baby, nothing is gonna get fixed.
How much do you normally feed the baby once that becomes a problem?
It depends on the age.
Yeah, okay.
So a 1 day old, a 24-hour old baby.
Okay,
So
gotcha.
let's say, for example, a 3-kilo baby, that's about 30 mLs every 3 hours. So we're gonna use the supplementation as a bridge. We're going to breach this baby until your milk comes in.
For the families out there, why is preventing excessive jaundice, low blood sugar, excessive weight loss, and dehydration important to a baby? Why do they even need supplementation?
If you don't have sugar, your brain doesn't work well. If your blood sugar is low, then your brain cells get in trouble. And what they have found is that there are some changes, 5-10 years. There are some changes in these babies compared to babies that actually did not have that. Related to the IQ, changes related to the anatomy of the brain. We want 3 continuous blood sugars above 50. Jaundice part, we are very picky again with jaundice, that jaundice will go into the brain and will cause issues, which is the kernicterus. The bilirubin gets deposited in areas of the brain and it causes brain damage. And this brain damage is manifested by a very, very decreased IQ and also changes in the motor capabilities of the baby.
Yeah.
And the adolescent and the adult later on. So kernicterus, thankfully, is not very common. We are very good checking, and now the times that kernicterus happen is more related to blood type incompatibilities than plain dehydration. And then the other thing is excessive weight loss and dehydration. So what happens if you stop drinking water as an adult? What happens if I stop drinking sugar? Well, I have fat. Babies don't have that much. They have a little bit. They can take care of it for a bit, but not all the time. What happens if I don't drink water? I get dehydrated. I might pass out. If the baby doesn't drink water, it's basically the same thing. And supplementation is not the end of the world. It's a bridge in many countries in the world, in France, for example, supplementation is super common. It's the standard of care. Japan, they use also quite a bit of supplementation.
Would you say that the scenario where a mother, especially in the postnatal period, doesn't have enough milk and it is causing excessive weight loss or these other complications like jaundice, dehydration, low blood sugar, would you say that's rare?
No, no, that's 60% of the couplets. Sometimes the baby don't latch well. Actually, a lot of times the baby don't latch well. So I just came off service yesterday morning, and during my week of service, I had 4 admissions because the baby was not eating well. The mom was producing a ton of milk, but the baby didn't latch correctly, but the baby was lazy, was falling asleep, was not doing it correctly.
What about the scenario where babies latch fine, but mom doesn't have enough milk? Is that a rare situation?
No, that's very common. That is the most common one. If you have 100 women and 60 women have issues with feeding, probably 40 to 50 of those are going to be because the milk supply is not enough yet. And the rest is going to be because the baby is not eating.
That's the thing that is most surprising to parents, because what they're being told, the situation where there's not enough milk, it's so rare that you don't need to worry about it. And then this happens. And then they get surprised and they think they're failing when they're totally normal. Their baby just needed a supplement to get them to when their milk is enough. What are the signs of a baby not getting enough milk where they need to do something, get some medical attention or get a supplement right away before they get inside the hospital?
The first thing is the satisfaction of the baby. A baby that is well fed, a baby that had a good breastfeeding session, is a baby that normally is going to be satisfied. It's a baby that normally is going to fall asleep and is going to wake up in the next 2 to 3 hours, sometimes even 4 hours. Breastfeeding needs to be seen as a medical intervention, and therefore it has risks, issues that can happen. So what are the signs that you can look for? How is the baby sucking? Can you hear the baby swallow? Okay, we count how many swallows happen per suck. If the baby sucks 1 or twice and then swallow, that means that the baby got milk. If you hear that the baby is sucking, and then swallowing every 4 or 5, then you need to look for some help. And then obviously the wet diapers and the stools. I always tell parents, if it has been 12 hours and you haven't seen a wet diaper, you need to get that baby to the ER. You need to get that baby somewhere. That baby needs to be seen. 12 hours is my cutoff. So you feel your breast getting fuller before a breastfeeding session, or that they're getting softer after.
What are the severe signs of underfeeding? Like, what are signs of hypoglycemia or
the baby's not going to be moving.
Severe jaundice?
It's not going to be moving. It's not going to be crying. You're going to see that their energy level is already going down.
You know how they say high-pitched crying? What does that mean?
That's like passing your nails on the chalkboard. It's terrible.
If a mom sees jaundice at home, when should she be concerned that jaundice is too high?
The most important question is what did you see when they checked the level? They checked the level and you saw that the baby had a little bit of jaundice on the face, and then you are at home and you are seeing that the baby actually looks way more yellow. Then call your pediatrician or come to the ER. We have a machine that is the transcutaneous bilirubin that you just basically put it on the forehead, and it can give you a quick number. If it is way high that we're expected to be, then I check a blood sample, and then we get it treated. Because the other problem with jaundice is that jaundice will make the baby sleepy.
So if someone calls from home with these signs, high-pitched crying, no wet diapers, do you recommend that they feed their baby a bottle as they're making their way into the hospital?
Oh, yeah.
Or what do you suggest?
Yeah, please feed the baby, come to the ER.
We'll how much? How much would you recommend?
Whatever the baby wants to take. Breastfeeding needs to be seen as an intervention, and it's something that is a learning experience for both the mom and the child. And if it's not working correctly, that's okay. We are going to help you. We're going to support you. Every 3 hours, you put your baby on the breast, 10 minutes on each side, and then you supplement as the days passes. Then you're going to need less and less supplementation until you get to your goal. We don't get anything from formula. Don't sincerely care about the formula companies. We want is the families to be well. We don't want these things to happen to people.